Question 26. A nurse is caring for a client with active upper GI bleeding. What is the appropriate diet for this client during the first 24 hours after admission? A. Skim milk. B. Nothing by mouth. C. Regular diet. D. Clear liquids. Correct answer is B. Nothing by mouth. Question 27. Which of the following terms is used to refer to intestinal rumbling? A. Diverticulitis. B. Tenesmus. C. Borborygmus. D. Azoturia. Correct answer is C. Borborygmus. Question 28. A nurse is teaching a client with malabsorption syndrome about the disorder and its treatment. The client asks which part of the GI tract absorbs food. The nurse tells the client that products of digestion are absorbed mainly in the A. Rectum. B. Stomach. C. Small intestine. D. Large intestine. Correct answer is C. Small intestine. Question 29. A client with Crohn's disease is scheduled to receive an infusion of infliximab, Remicade. What intervention by the nurse will determine the effectiveness of treatment? A. Monitoring the leukocyte count for 2 days after the infusion. B. Checking the frequency and consistency of bowel movements. C. Checking serum liver enzyme levels before and after the infusion. D. Carrying out a hematest on gastric fluids after the infusion is completed. Correct answer is B. Checking the frequency and consistency of bowel movements. Question 30. A client has a PRN prescription for loperamide hydrochloride, Imodium. For which condition? Should the nurse administer this medication? A. Constipation. B. Abdominal pain. C. An episode of diarrhea. D. Hematest positive nasogastric tube drainage. Correct answer is C. An episode of diarrhea. Question 31. A client has a PRN prescription for ondansetron, Zofran. For which condition should the nurse administer this medication to the postoperative client? A. Paralytic ileus. B. Incisional pain. C. Urinary retention. D. Nausea and vomiting. Correct answer is D. Nausea and vomiting. Question 32. A client with a gastric ulcer has a prescription for sucralfate, Carfare, 1g by mouth 4 times daily. The nurse should schedule the medication for which times? A. With meals and at bedtime. B. Every 6 hours around the clock. C. 1 hour after meals and at bedtime. D. 1 hour before meals and at bedtime. Correct answer is D. 1 hour before meals and at bedtime. Question 33. A client who chronically uses nonsteroidal anti-inflammatory drugs, NSAIDs, has been taking misoprostol, Cytotec. The nurse determines that the medication is having the intended therapeutic effect if which finding is noted? A. Resolved diarrhea. B. Relief of epigastric pain. C. Decreased platelet count. D. Decreased white blood cell count. Correct answer is B. Relief of epigastric pain. Question 34. A client has been taking omeprazole, Prilosec, for 4 weeks. The ambulatory care nurse evaluates that the client is receiving the optimal intended effect of the medication if the client reports the absence of which symptom? A. Diarrhea. B. Heartburn. C. Flatulence. D. Constipation. Correct answer is B. Heartburn. Question 35. A client with a peptic ulcer is diagnosed with a Helicobacter pylori infection. The nurse is teaching the client about the medications prescribed, including clarithromycin, Biaxin, esomeprazole, Nexium, and amoxicillin, Amoxil. Which statement by the client indicates the best understanding of the medication regimen? A. My ulcer will heal because these medications will kill the bacteria. B. These medications are only taken when I have pain from my ulcer. C. The medications will kill the bacteria and stop the acid production. D. These medications will coat the ulcer and decrease the acid production in my stomach. Correct answer is C. The medications will kill the bacteria and stop the acid production. Question 36. A client has a new prescription for metoclopramide, Reglan. On review of the chart, the nurse identifies that this medication can be safely administered with which condition? A. Intestinal obstruction. B. Peptic ulcer with melena. C. Diverticulitis with perforation. D. Vomiting following cancer chemotherapy. Correct answer is D. Vomiting following cancer chemotherapy. Question 37. A patient with Crohn's disease is most likely to have the disease is what part of the GI tract? A. Rectum. B. Duodenum of the small intestine. C. Terminal ileum. D. Descending colon. Correct answer is C. Terminal ileum. Question 38. You're providing teaching to a patient who has been newly diagnosed with Crohn's disease. Which statement by the patient's spouse requires re-education? A. Crohn's disease can be scattered throughout the GI tract in patches with some areas appearing healthy while others are diseased. B. There is no cure for Crohn's disease. C. Strictures are a common complication with Crohn's disease. D. Crohn's disease can cause the haustra of the large intestine to lose its form. Correct answer is D. Crohn's disease can cause the haustra of the large intestine to lose its form. Question 39. A physician has prescribed a patient with a severe case of Crohn's disease to take a drug that works by suppressing the immune system. This medication achieves this by blocking a protein that plays a role in the inflammatory process. Which drug does this describe? A. Azathioprine. B. Sulfasalazine. C. Infliximab. D. Prednisone. Correct answer is C. Infliximab. Question 40. A patient with Crohn's disease is taking corticosteroids. The patient is complaining of extreme thirst, polyuria, and blurred vision. What is your next nursing action? A. Check the patient's blood glucose. B. Give the patient a food containing sugar, X, orange juice. C. Administer oxygen via nasal cannula. D. Assess bowel sounds. Correct answer is A. Check the patient's blood glucose. Question 41. Which signs/symptoms should the nurse expect to find in a client diagnosed with ulcerative colitis? A. 20 bloody stools a day. B. Oral temperature of 102 degrees Fahrenheit. C. Hard, rigid abdomen. D. Urinary stress incontinence. Correct answer is A. 20 bloody stools a day. Question 42. The client diagnosed with inflammatory bowel disease has a serum potassium level of 3.4 milliequivalent/L. Which action should the nurse implement first? A. Notify the healthcare provider. B. Assess the client FO muscle weakness. C. Request telemetry for the client. D. Prepare to administer potassium 4. Correct answer is B. Assess the client FO muscle weakness. Question 43. The client is diagnosed with an acute exacerbation of ulcerative colitis. Which intervention should the nurse implement? A. Provide a low-residue diet. B. Rest the client's bowels. C. Assess vital signs daily. D. Administer antacids orally. Correct answer is B. Rest the client's bowels. Question 44. The client is diagnosed with an acute exacerbation of IBD. Which priority intervention should the nurse implement first? A. Weigh the client daily and document in the client's chart. B. Teach coping strategies such as dietary modifications. C. Record the frequency, amount, and color of stools. D. Monitor the client's oral fluid intake every shift. Correct answer is C. Record the frequency, amount, and color of stools. Question 45. The client diagnosed with Crohn's disease is crying and tells the nurse, "I can't take it anymore. I never know when I will get sick and end up here in the hospital." Which statement is the nurse's best response? A. I understand how frustrating this must be for you. B. You must keep thinking about the good things in your life. C. I can see you are very upset. I'll sit down and we can talk. D. Are you thinking about doing anything like committing suicide? Correct answer is C. I can see you are very upset. I'll sit down and we can talk. Question 46. The client diagnosed with IBD is prescribed sulfasalazine, a sulfadine, a sulfonamide antibiotic. Which statement best describes the rationale for administering this medication? A. It is administered rectally to help decrease colon inflammation. B. This medication slows gastrointestinal motility and reduces diarrhea. C. This medication kills the bacteria causing the exacerbation. D. It acts topically on the colon mucosa to decrease inflammation. Correct answer is D. It acts topically on the colon mucosa to decrease inflammation. Question 47. A client who has had ulcerative colitis for the past 5 years is admitted to the hospital with an exacerbation of the disease. Which of the following factors was most likely of greatest significance in causing an exacerbation of ulcerative colitis? A. A demanding and stressful job. B. Changing to a modified vegetarian diet. C. Beginning a weight training program. D. Walking 2 miles every day. Correct answer is A. A demanding and stressful job. Question 48. Which goal for the client's care should take priority during the first days of hospitalization for an exacerbation of ulcerative colitis? A. Promoting self-care and independence. B. Managing diarrhea. C. Maintaining adequate nutrition. D. Promoting rest and comfort. Correct answer is B. Managing diarrhea. Question 49. A client's ulcerative colitis signs and symptoms have been present for longer than 1 week. The nurse should assess the client for signs and symptoms of which of the following complications? A. Heart failure. B. Deep vein thrombosis. C. Hypokalemia. D. Hypocalcemia. Correct answer is C. Hypokalemia. Question 50. A client newly diagnosed with ulcerative colitis who has been placed on steroids asks the nurse why steroids are prescribed. The nurse should tell the client: A. Ulcerative colitis can be cured by the use of steroids. B. Steroids are used in severe flare-ups because they can decrease the incidence of bleeding. C. Long-term use of steroids will prolong periods of remission. D. Long-term use of steroids will prolong periods of remission. Correct answer is B. Steroids are used in severe flare-ups because they can decrease the incidence of bleeding. Watch out for more Alveoly e-learning exam series. Subscribe, comment, and like our videos on our YouTube channel. Thank you.